Hello, this is Chris Bartlett from Dental Roots. And this evening we're going to be talking about the advantages of using a dental laser when placing and looking after dental implants. This is something that's quite close to my heart because I've been around working with people placing implants for getting on for 18, 19 years. And it's actually something I've never seen being used until I met the guys being used doing implantology. So this is something where I thought that having all of that knowledge, it's worth now trying to spread that between the community so that people can hear what people are using the laser for when they are doing implantology. So first person that's going to be coming up that I'll be talking to is Dr. Koushik Naik. And the first question that I'll be placing with him is, what parts of implantology do you use the laser for?
Oh, thank you, Chris. You always sort of probably listen to my heart all the time and come up with these questions. And I always used to feel from the time I went on to start using dental lasers in different aspects of dentistry on why have we been so late and why are we consuming so much time in terms of using them on a day-to-day procedure. The more and more I try to use it, the more I feel so strongly about it. So today, as you have explained me, we are only talking about how lasers are being used in implantology in particular. So I'll keep my discussion very specific to that aspect only. So your first question of where all I generally use dental lasers in implantology. At every stage, Chris, at every stage, because of the amount of advantage dental laser gives me in terms of doing the procedure, in terms of patient experience while I have done all these procedures, and in terms of the overall outcome I consistently get when I use dental laser as an adjuvant with all the traditional steps that I use when I'm placing dental implant in a patient's mouth. So the first aspect, obviously, when we are placing a dental implant is the initial incision. Dental laser, which is your high power dental laser. So there are different aspects of dental lasers, there are different types of dental lasers, which we did cover in your last session. I'm only talking about a high power dental laser. The one that I use is called as a erbium YAG dental laser. Okay, it has a much higher power than your diode lasers because it can cut soft tissue as well as hard tissue. It can use both kind of situations for you to work with. Initial incision, cutting the gum. I use my erbium YAG laser to do it. The main reason why I use it is because it is very crisp. It has a wonderful amount of control compared to a normal scalpel when I use it. The amount of bleeding you can see in that picture there, the amount of bleeding is extremely minimal. And while it is cutting the gums, it is also creating some kind of energy infusion into the tissue, which I'll come to you later on how it helps in healing that tissue later on. So first thing, incision of any kind within the soft tissue. The second thing I use it for is again to make that initial osteotomy within the bone where I need to place the implant. As we all know, when we use a drill, the first thing we were always taught about is how a drill can just waver, the drill can just get away from the side, the amount of tissue damage we might cause by the wavering drill, the vibrations in the hand, so on and so forth. With a laser, now you can see how the laser has gone into the gums, makes a very crisp, precise dimple in the bone. You have full control on at which speed you need to create the dimple. It is completely safe to all the surrounding tissues, and you can take your time and make sure the dimple or the first cut is extremely precise. That is the reason why I always try to use a laser for that as against the traditional pilot drill that I was so used to when I used to first start doing dental implants.
Just a quick question there, Koushik. So when you are close to the tissue, you never touch the tissue with the tip. So actually, you're not actually having to rest the actual tip itself onto the tissue. I guess visually as well, that's a reassuring thing to be able to see it.
Yeah. When you're cutting a soft tissue, you always come in contact with the soft tissue.
You do.
When you're yeah. But when you are cutting a hard tissue, you do not come in contact with the hard tissue. And that is how you have a wonderful control on your way of dealing with the hard tissue, because you don't actually come in contact with the hard tissue.
Okay, thank you.
Okay. And the second aspect, which makes my life so easy and which makes life so predictable, is what you can see on the picture, where you have granulation tissue when you have taken a tooth out. You have infected sites every time you want to come in contact with these kinds of situations where you want to place an implant. And traditionally, what was my approach? I used to consistently try to scrape it up as much as possible, leave the body to take its course to heal it and disinfect it, and then come back to see how I can place an implant. But that is the thing of the past in my practice, because you see that site on the right. That is after I have used my erbium YAG laser to literally clean up the whole socket, and it looks so crisp. There's fresh bleeding, the bone looks absolutely wonderful, and I am very confident at this stage that I can place biomaterial, I can place implant, or I can leave it just to heal as it is. And in each case, I am confident that the chances of any infection in the socket is almost nil. And to substantiate that, I have this next.
Sorry, Koushik, just sorry to make you go back to that one, because it's a fascinating question. So if you were wanted to, for instance, clean that socket out, you would just put the laser onto soft tissue, and then that wouldn't touch the hard tissue. It would just clean away everything in all directions as well, I'm guessing.
Yeah, you just put the tip all over that area wherever there's granulation tissue, and the tip, you vaporizes it off. You can literally see all the tissue just vaporize off, and it penetrates into the creases of the bone without even touching the bone, and completely dries it off.
Wow.
So that way you are 100% sure that there is no granulation tissue even left within the crevices of your bone. And you can never ever achieve that level of disinfection and complete sweep of all the granulation tissue by using our traditional curating or any other methodology that you use. It's absolutely, at least in my hands, it's absolutely not possible to do so. And even if I do it, how confident am I in terms of feeling that I can go ahead and place my bone augmentation or place my implant in that site? I personally am not confident at all. And that is how laser has made such a big difference, because this area is crisp and clean.
Fantastic.
Yeah.
Thank you.
And also what it does not only clean that area, while it is cleaning it, it is packing all the cells around in the bone and the soft tissue with kind of photon energy. And the photon energy, a lot of studies are out there to show how it increases the reparative capacity of the cells, whether it's the osteoblasts, whether it's the gum cells, or all of those. So it is actually doing two things. One, it is cleaning up the site, and it is also increasing the healing capacity of the tissue. And this is where the next slide shows where I've cleaned up the socket, I've placed the implant at the same time, I've augmented the whole area, and in a week's time, this is what I see as a healing. There is no inflammation, there is no swelling, and the patient has had no pain whatsoever after such a sort of invasive procedure. And 4 weeks' time, it's amazing the way it looks. Nice pink with no inflammation whatsoever. Okay. And this is why I use dental laser in almost all these kind of scenarios. And mind you, even when I do an osteotomy in a traditional delayed implant placement, I still go, even if you say you're going to do a traditional osteotomy with your traditional drill to make sure the measurement is right, to make sure the whole width is right and everything else. You dip your laser into that socket, leave it for a few seconds just for the energy to soak in, and then place your implant. And that osseointegration you get within that socket and the amount of healing you get is much, much faster and predictable, which you will later on see in certain other slides. So even when I do an osteotomy, I try to go in with the laser so it just enriches the whole socket before I place my implant. Now we are actually looking at it in a different angle because a lot of manufacturers talk about conditioning the implant surface for better osseointegration. Guys, how about conditioning your osteotomy site for a better osseointegration? Okay, it's a completely different way of looking at it, and the studies that are there to show it just is an enlightening space. And then this is where I think why implants and dental lasers go so well hand in hand for a better predictability, but also for a better patient experience. Now, finish your initial surgical aspects of dental lasers in implantology, but now come to your second stage surgery. What was I doing before in a situation like this? Now I have to cut a flap. I either go for a hedge flap or a crustal incision or whatever, and then have to place your healing abutment, then suture it back again, call the patient back after 4 weeks, take an impression. Look at this, guys. I don't have to cut an incision. I don't have to take a flap, nothing. It's just cleaning up that whole socket. I've gone into the implant, and I need to stress here that the bleeding is very minimal when you do use dental lasers, okay? And so this socket is more or less very dry. You can even take your impression at the same stage and then put a healing abutment if you wish to. And especially if you're doing a provisional crown and so on and so forth, that's all done in the same stage. And you have another big advantage of using a laser here as against your traditional method of incision and exposure. Okay, that's the next stage of where I use it. This is a hot topic all the time, and that is, I think we all are getting more and more and more familiar about this situation as the amount of implants that we are placing is only getting more and more, which is your peri-implantitis situation. Okay, what predictable ways do we have to clean an implant in a very nice way so I can have a nice sleep at the end of the day? Very, very, very few ways of doing it. And that is where, again, the erbium YAG laser, this laser that I use, which is your erbium YAG laser, is the most preferred laser of all the lasers that is there in the market when it comes to completely decontaminating your implant surface. It does it to the T. You can augment the bone at the same stage and cover everything up, and the healing is fantastic. So we have covered almost all these aspects of the surgical stage, the second stage surgery, and complications of dental implants, and that is how you can use them in different ways when you're placing implants. Okay.
Just a question with the peri-implantitis, because obviously it is a very, very hot topic, and it's going to become more and more and more and more. Could let's just say that other people in the team could a hygienist use a laser? You know, they're forever being asked to manage around the top of implants that have problems. I guess a laser could be used by a hygienist as well. They just need to get their module 1 laser certification, and then they could actually use a laser too, I'm guessing.
Absolutely. That's a wonderful question out there, because you're talking about the surgical aspect and the placement aspect which the clinicians do. And then you're talking about the maintenance aspect of your teeth, but also maintenance aspect of implants, right? And the big hot topic right now is about minimizing the bacterial flora within your pockets and within your mouth. And one of the big topic again is about how we should use antibiotics in terms of controlling these kind of pathological situations. With dental lasers, we call it as APDT, or antibiotic or antibody photobiomodulation therapy, where we use certain dyeing agents which the bacteria preferentially absorb, and then we use certain laser wavelengths, which the bacteria then absorb because they would have absorbed the dye already. So there is preferential absorption of these dental lasers by the bacteria only, which will lead to destruction of the bacteria. So you can completely sterilize a perio pocket or a peri-implantitis pocket just by using a dye and a laser with no need of any antibiotic whatsoever. Okay, this is a revolution in the dental space because it makes a massive impact to the way we deal with the situation like that.
It's basically a disclosing tablet for laser.
It's more or less, more or less very, very, very
Yeah.
similar. If I got to talk to you in a simple term, that's exactly how it works. Yeah.
Okay, cool. Okay, thank you.
Okay. And add to that, what we generally do is we have always dealt with certain additional complications while we are doing implantology on a day-to-day basis. A small example is you have a high frenal attachment just next to the implant that you have placed. You might have an overgrown gingiva where you just need to do a bit of a gingivoplasty. You need to do a bit of a crown lengthening. And these things were considered very hi-fi soft tissue surgical techniques in the past, and people used to get worried to be doing these things in addition to their day-to-day treatments. But now what has become so easy is a freenectomy like what you see on the screen takes me just 10 minutes. Okay, a freenectomy like that, just 10 minutes while I'm doing my implant treatment. So if, for instance, imagine that tooth was an implant tooth, which it is not here, and then you have a high frenal attachment, 10 minutes, you would have just cleaned up all the muscle fibers out there. The bleeding is so minimal. 1 week later, this is the healing. You can even actually see the amount of growth that the gingiva has already achieved around that tooth up there. All right. So these kinds of additional adjuvant treatment, or say for instance, there was a bit of excessive gum growth up there. It takes you 10 minutes to just sculpt the gum away. Okay, so that's the additional benefit of you having the laser by your side while you're doing treatments with related to dental implants. So if I can summarize the whole aspect of what I was discussing all this while, as a whole, by just having that nice, beautiful machine next to you when you're placing a dental implant, I am one hand on my heart confirm that my socket is completely disinfected and my surgical site is completely disinfected. I very, very, very assured now that the discomfort the patient has post-treatment is extremely minimal because I've constantly studied on this aspect with every patient I see. The amount of soft tissue healing time is drastically reduced. The amount of inflammation is so minimal that the healing time is very, very minimal post-operative. And the amount of osseointegration with your implant is extremely fast. It's very, very fast. There's quite a few. I just quoted one study out here, but there are multiple studies out there which shows the rapidity in which osseointegration happens around your implant when you have used laser to enrich the tissue. Okay, so would that answer the question that you have asked me?
Yes, thank you very much. Really appreciate that. Thank you.
Perfect.
So we go to the next slide. So the next question goes to Jay, and Jay is going to answer hopefully what the advantages does doing these procedures increase predictability. And the reason I put this in here is knowing what you're doing to accelerate what you do in the chair is great, and that can really help a lot of people with time aspects. But also, I think one of the things that we really need to even increase, even though implants have a fantastic predictability, it's about going that extra mile. And so it's a tough question, Jay, but does using the laser to do these procedures increase your predictability?
Yeah. I'm glad that you asked me this, Chris. Hi, and that's my slide. Modern dentistry is evidence-based, and predictability is essential and determines treatment protocols. There is enormous amount of research, as Koushik mentioned before, and clinical studies to support what I am going to say here. I will restrict my discussion to my own experience here. Otherwise, it would take too much time. I've also personally noticed that my implant procedures have become more predictable after introducing lasers into my implant treatment protocols. This is in comparison to conventional techniques done by me previously. Some of the advantages which Koushik highlighted have improved predictability and hence the success of treatment in general. I will discuss this now. Lasers are very precise in action. They're very easy to use. There is very minimal skill required. There is more knowledge required, but skill levels are very minimal requirement. The lasers can be used in contact with tissues as when you are treating soft tissue, and out of contact when you're treating hard tissue like teeth or bone. So unlike conventional techniques using rotary burrs, there is no possibility of accidents like slipping of the burr, which could cause catastrophic damage to adjacent tissues. It's very safe. Lasers also achieve precise controlled action by selectively targeting of tissue. So when you're using it on soft tissue, there is no action on hard tissue and vice versa. And high levels of precision because of this, and works to and it acts towards depths of micrometers. In erbium yard, it's about 15 microns depth basically. We see reduced inflammation and pain, which is due to less thermal or mechanical damage, which we would see otherwise in conventional techniques. Issues such as soft tissue or bone resorption associated with inflammation are almost non-existent, and hence procedures like immediate implant placement and soft tissue surgeries are more predictable. You saw some of the cases which Koushik presented, where he could remove granulation tissue and place immediate implants straight away without having to worry about bone resorption or soft tissue recession. In post-implant surgery reviews, in my own cases, I have seen that there is very limited signs of inflammation, and patients reinforce this saying how little discomfort was present post-surgery. Bleeding is always a concern post-surgical treatment. In my surgical cases, I'm able to coagulate the extraction sites as well as the implant surgical site with lasers immediately after surgery and thereby control bleeding. I have noticed even in my post-surgical review appointments that there are very few patients complaining of post-surgical bleeding. This predictable outcome has resulted in reducing patient anxiety, improved patient comfort, and confidence in the entire procedure. I also notice reduced infections in patients after use of lasers. Use of lasers in photodynamic therapy results in inhibition of bacterial growth in the target sites and require less or no antibiotic usage. Koushik again brought this up in how it is used in periodontal problems or in peri-implantitis. In my practice, early stage peri-implantitis is now treated exclusively with the use of lasers, and this predictably with minimal discomfort to my patients, with almost no explantations since I have started using lasers. There is also improved tissue healing seen after laser use, and primary healing post-surgery is recognizably improved after the use of lasers during surgery and with photobiomodulation therapy, which is due to biostimulation of the tissues. For example, I have got a case which I can show you next. As a routine, I am now able to do second stage surgery, which is the implant exposure. and implant impressions. In my case, I've done digital scans on the same day due to good hemostasis and predictable soft tissue healing. I'm not worried about soft tissue recession. I've also noticed improved rate of osseointegration. And this is going to be one of my thesis topics. My post-surgical review appointments have become fewer because of the rate of healing. Introducing lasers into my implant treatment protocols has resulted in fewer complications involving swelling, pain, infections, bleeding, etc., and thereby reducing the visits for my patients. This essentially has reduced the anxiety levels in the surgery and improved the overall confidence for my patients in my practice and implant treatments in general. I think lasers is tomorrow's dentistry being practiced today. And I'm very, very happy that we have got access to this technology.
Just a quick question for you, because what was going through my head, when you do some items which could be classed as more advanced surgery, maybe sinus lifts.
Yeah.
Am I right in saying that the laser then would cut bone, but not the membrane?
Correct.
Is that correct?
Absolutely.
So it's like a super tool, really, because that's one thing that ultimately using any other method has a risk to it. You can predictably, one in 100, 1 in 1,000, 1 in however long, make a mistake and actually tear the membrane. I'm guessing that this it won't happen. Is that right?
You're absolutely right, Chris.
Okay.
So one of the things that we show trainee dentists who are learning lasers newly, we make them cut actually a raw egg, just take the shell out with lasers, with leaving the internal membrane of the raw egg intact without spilling of the inside of the egg. And it is done completely in a predictable way and every single time.
Yeah. Cool. Thank you.
Thank you.
Okay, next one.
Next one, Koushik.
So this one's going to go to Koushik or Jay. I can't remember on this one.
Koushik, yeah.
Yeah, Koushik.
I'd like Koushik to take this.
Yeah, no, it's okay. Yeah, again, another one that is, because this is a high ticket item. These are not 10 a penny machines that you buy. This is something that you're going to invest in because you want to improve your clinics, and you're going to want to gain something from it, from the commercial side as well. So does the laser allow you to reduce treatment times and patient visits, which obviously saves everybody at that stage, because the less visits to get a better outcome will actually increase the bottom line.
Yeah. No, you're spot on there, Chris, because every time one of the big things about dental roots, what I consistently say is we are not just talking about clinical application of technology. We are also consistently looking at making business sense to every clinical application of technology, because if that has to last, if it has to get into every practice, then that's extremely important that it makes business sense to each of us, right? And on that basis, there are two things to make it clinically viable and viable for your business as well. One is the amount of time you can save with the treatments, as like what you explained. And the second thing is giving you a better patient journey and a better patient outcome. So the patient who comes to your practice feels so much more reassured on whatever they get is in the best lines of what is available in today's date, right? So the aspect that you spoke to me about is how are you reducing time by using dental lasers in dental implants specifically, because that's what we are discussing today. Massive amount of time saving, I would say. Let me just take this case up. I did show a couple of slides in the past. So this is a lady who was referred to me by her husband because her husband has been a patient of mine for a lot of years. He had all his rehabilitation done, and his wife was jumping from practice to practice with a lot of issues in her mouth. And she was so unhappy that people were not even ready to take her case because that socket that you see there, it was a failed root canal treatment. There's massive amount of bone loss. I haven't put the x-rays. I should have put it probably. And people were not ready to take that on for themselves. So she came to me eventually because her husband dragged her in and said, I think I have sort of taken you to too many places, which I'm getting a bit fed up with. So let me go to my dentist and see what he thinks. So that's how she landed up in my practice. We eventually planned to get rid of those three teeth that were quite badly infected and replace them with dental implants. If this patient had come to me probably before I had started using dental lasers, my protocol would have been I would have taken those teeth out, I would have cleaned up all the socket, left that patient for 3 to 4 months, got the patient back again, see how the healing is, see how much bone loss has happened vertically and horizontally. At that stage, I would see if I need to do a sinus lift or do I get away without a sinus lift? Is there enough amount of vertical height, so on and so forth? Place the implants at 4 months' time, send the patient back again for another 4 to 6 months, depending upon if I did the sinus lift or not, then get her back for the final restoration. All in all, I would estimate around about 10 to 12 months' time from start where the extraction happens to finish where I would have given her implant retained teeth. Okay. Now, the same scenario today, what I basically do is I pull the tooth out. I have cleaned the whole socket to my satisfaction. Once I've cleaned it, I've been able to place the implant in the socket. So all these three stages have happened in the same appointment, where it would have taken me at least 5 to 6 months before. Okay, so I placed the implants at the same time, and I augmented the whole socket at the same time. And what I've achieved by doing all of this is one time, and second is the amount of tissue management. So I know that whole tissue is healing up nicely within the infrastructure that is put in there. The scaffolding is there, so the tissue doesn't disappear. And hence, within a week's time, this is the healing that I have achieved. And within 4 weeks' time, this is the level of healing I've achieved. I've literally lost no vertical height whatsoever. Neither have I lost any kind of a horizontal thickness of that whole tissue. So the amount of inflammation that you don't see at all within that area is amazing. And the patient, she was one of these patients who used to panic, and that's one of the reasons why she didn't even get into dental implants, okay? Because to be honest with you, I was the same operator who treated her husband without dental lasers 5 years ago. And she had seen the amount of bruises he had on his cheeks. She had seen the amount of days it took for him to heal, the amount of painkillers he had taken, so on and so forth. And then she had come to me after 5 years, and this time I had used dental lasers, and voila, 2 weeks later, she comes and says, oh my God, how is it possible that I had such a wonderful healing compared to how my husband used to look with all these bruises on his face? So I had to smile inside. I couldn't tell it too loud because he was there in the room as well. But that's the wonderful thing about dental lasers. The healing was so wonderful, and the post-op healing and also integration is so fast that within 3 months, I was able to restore that patient with her full crown and bridge in that situation. So what have I achieved? I've just taken 5 months to complete this case as against 10 to 12 months that I would have taken without the assistance of a laser like the erbium YAG laser. Okay, so that speaks a lot of things. At least for me, it sort of says how we can embrace technology in a right way with the right knowledge to give the best experience for the patient and also make it a good tool to create a wonderful business model for your practice on a day-to-day basis. A very similar situation again, where a patient came to me with this fracture implant, which was put in some other practice, and he was referred to me by one of my dental colleagues. And the same case, what I would have done probably before I was using dental laser. So I had to have initial surgery just to retrieve the dental implant, to disinfect the whole socket, probably maybe argument, or just leave the socket to heal on its own, get the patient back after 4 to 5 months, revisit the site, place an implant, 5 to 6 months later, restore. Okay, again, I'm talking about 10 to 12 months time by the time I would have finished a case like that. But in this case, I was able to take the implant on the same day, disinfect the whole socket completely as soon as I took the implant. I was able to recreate the osteotomy site properly and place my implant in the socket on the same day. Okay. And that's with a lot of confidence. There is no thought in my mind saying, oh, will it work? Will it not work? Will it get disinfected? No. I know for a fact that this will work. Okay. And 3 months later, this is what you see. Okay, a wonderfully healed socket, a wonderfully healed soft tissue. All I need to do is to take the impression and the tooth is back again. So the bottom line is very simple. Taking 4 months to complete a case like this, as against 10 to 12 months and multiple appointments, is what my dental laser allows me to do. And the amount of wonderful response I get from my patient will not only grow the business consistently, because now I know what this patient is going to go and talk to other people about what his or her experience is about dental implants, but also I have saved myself 6 months and probably 2 or 3 hours of my work time doing the same case. So to give you a brief summary, I think with these cases, you would be able to more or less understand how you can use dental lasers to your advantage and your benefit in terms of creating a wonderful business protocol for yourself.
Without doubt, you can sort of see it's a win-win. You know, it's rarely you get that, especially a guy that was a sales guy for those 40 years in dentistry. Everything was about either making it easier, quicker, patient journey, but rarely were they all brought together. Did they actually, you know, become one thing? And it's great to see that technology is not just making it more comfortable or just quicker. It's actually also increasing predictability. It's increasing the outcome for the patient, reducing the visits. Nobody likes to visit the dentist. So actually, again, sounding a bit like a sales guy, but it's actually really nice to know that there's a bit of kit out there that actually can also help your bottom line, because you can't just invest in something just because it may help the patient on the patient journey. This isn't making a teeth just white. This is actually about treating the whole patient with all the different disciplines. I know we're talking about implants today, but yeah, that's fascinating. Thank you.
Welcome.
Right, now this one, I guess, is this going to go to Koushik and Jay, or is it just to you, Jay?
I can take it.
Okay, cool. Right, yeah. So this is a real tough one, because I'm going to tell you a quick little story. Many years ago, many years ago, I used to work for a manufacturer who sold dental laboratory equipment, and they manufactured a steam cleaner. And this steam cleaner, they sold quite a lot of. But when we were ever at shows, people used to say, what do you need a steam cleaner for? And we knew that if you just gave somebody a steam cleaner for a week, they would rather kill you than let you take it away. And because it's one of those tools that if you've never had it, you'll never know. You will never know what that kit does for you. And as soon as we gave them the steam cleaner to try it for a while, they actually tried it. And then they said, how have I ever been able to do dentistry or dental laboratory work before without a steam cleaner? And all it did was actually steam clean. It was like a little micro-powered jet wash, ultimately. But it completely improved the laboratory all the way through in everything that they did. It was just more precise. Everything was cleaner, the models, etc. And I was thinking about it the other day, and I think this is going to be the same thing for lasers. But I'm still going to put the question to you. Would you ever consider not using a laser in your implant practice?
So this is one question, Chris, I can answer without hesitation and with total confidence. It's an emphatic no. I can't imagine a day that I come to dental practice and not be able to use my laser on my treatments and patients. Lasers have become, Koushik, next slide, please. Yeah. Lasers have become an integral part of my routine dental practice, and more so in implant dentistry, which is my area of special interest. As Koushik was saying, even when there is no need for removal of granulation tissue, or if I don't use it on soft tissue incisions, at the end of the osteotomy site, I will use my laser so that the energy is absorbed into the tissue, both the bone and the soft tissue, so that absorbed energy results in better healing, better osseointegration. Some of the reasons I would never be without lasers going forward is improved patient journey. It reduces a lot of anxiety for my patients regarding implant procedure. Somebody who has gone through implant treatment with lasers and who has gone through without lasers. Some of my patients have had both experiences, and they tell me how much of a difference it was this time. There is improved patient comfort during treatment because of there is no vibrations. The whole procedure is much more simpler. There is noticeable better tissue healing. It improves the patient confidence due to predictable outcomes, and I'm able to deliver what I promise. Patients show appreciation and improved confidence in my own work. I routinely explain to my patients the role of dental lasers in their treatment. My patients are excited about the role of lasers in the provision of their dental care and appreciate the benefits it brings to their own well-being. I'm happy that I'm able to provide world-class dentistry to my patients using cutting-edge technology to achieve predictable outcomes and an improved patient journey. I don't think I could ever practice dentistry now going forward without lasers.
Okay.
And that would be my answer.
Yeah.
Thank you very much.
So on a philosophical note, it just came to my mind now. Okay, there is one of these guys whom I follow, and he was asking a question: where is happiness? Is happiness out there, outside, or is it there within you? Right? So actually, the happiness is there within you. You just got to find it. All right. It's if you start searching for happiness outside, you can go do 200 different things. It just doesn't give you that. It's a state of mind within yourself which you got to search and find out. Right. In the same way, where is healing? Healing is not on the implant surface. Healing is within your body. Okay. If you know how to search for healing within your body and make it work to your tunes, then you get the best healing. But what is happening in the markets today is they're trying to find healing on the implant surface and forgetting about how to enhance healing within your body. And this is where the key is. The key is, okay, guys, you do whatever you want to do to the implant surface. If your particular tissue healing is not at its best, no matter whatever implant surface you put, it could be coated with gold, your body is not ready to act in its best possible way. All right. Instead, just look inwards and see how you can enhance the healing capacity of your body and then see what the results are. And the whole technology of dental laser is based on this concept on how you are going to enhance the healing capacity of your body by just recharging it. Okay, you recharge your tissue, recondition your tissue, and then put whatever you want to put, and there you go. You'll have an amazing healing, you'll have an amazing outcome, and you'll have a wonderful predictability. Okay, and this is why I would say there is no to me doing dentistry without dental lasers.
Okay, thank you.